Hello, and welcome to Ask a Pharmacy Leader, Ask a Healthcare Leader with Visayo. This is a special one because I actually don't want to keep answering this question. It's, I've, yeah. So I've been getting this question for the last 24 hours now. People have been sending me this link about this doctor on the steps of Capitol Hill. I'm sure everyone's seen it by now, who claims she has 100% cure rate for COVID. Okay, so let's dissect that video. Um, for those that are not aware, this video went viral over the last 24 hours. It's a physician that claims that she's treated 350 patients and with 100% success rate using hydroxychloroquine, zinc, and azithromycin. Okay. And she said a few things in this clip that I saw, this clip that went viral, including hiccups are symptoms of COVID, which I had not seen reported or heard reported before, and that hydroxychloroquine was used in some study to treat hiccups effectively. So therefore, it's a good treatment for COVID, which is a stretch. She also said she only wears face masks. Her and the doctors behind her were not wearing any masks, and she said not to wear masks, amongst other things. And so let's dive into this because it seems every few months there's a new conspiracy theory. I did this when the pandemic video came out. I made a video and I kind of addressed some of the questions that I had received from that video. And so I will do this very quickly and very briefly. First things first, check your sources. Where is this information coming from? It was posted originally on Breitbart, which is a right-wing conservative news outlet. Fine. This video was then retweeted by the president after it had been taken down by Facebook, YouTube, and Twitter. Just FYI. This lady in the video is a pediatrician, actually. Upon further research, she's a pediatrician. And she doesn't have any privileges to work she's in any hospital in the city of Houston, which is where she practices, which is important to know. So that means she works outpatient, right? Upon further research, it's shown that she works in like an urgent care type of setting, which is cool. But she said something that doesn't add up. As a pediatrician, she mentioned she treats 80 and 90-year-old patients with diabetes and patients with diabetes and COVID effectively. I don't really know many pediatricians that treat 80 and 90-year-olds. That's just one. I don't think that's in the scope of their training to treat geriatric patients. Also, she doesn't work in a hospital. So that means she's not an ER physician. She's not an ICU physician. She's not an internal medicine physician. She's not a hospitalist. She's not a pulmonologist, which are, I mentioned those subspecialties because those are the ones that are really having to deal mostly with COVID patients. Oh, and the physicians that were standing with her were ophthalmologists, which for those who are not aware, those are doctors that treat the eyes, which really has not much to do with COVID so far. Those aren't necessarily the ones I that are on the front lines. Okay, let's go on to what was actually said, the content of the video. She claimed that hydroxychloroquine, zinc, and zithromycin were what she was using and seeing 100% cure rate, having treated 350 patients. There's also no proof or any way to validate these claims that she's making. So at best, this is just anecdotal data and maybe even a case study at best. But the actual science, the actual data, when scientists, researchers look at this medication and put it up to the rigors of a scientific study, which the most rigorous of them is a randomized controlled trial or study, which is the gold standard for drug approval in this country. In those trials, hydroxychloroquine has been shown to be no better than placebo, i.e. not effective. And the way medicine works, the way drug approval works, is you kind of have to be able to prove that the medication works and put it through, again, do an experiment, do a trial where you control for certain variables and then you give the patients this drug versus giving them something else and seeing. Anyway, that is actually, the gold standard of research. That has been done for hydroxychloroquine. And again, it has been shown to be ineffective. What she is claiming is at best anecdotal data. It is the lowest form of medical literature or research. It is just a case study at best, which is not even verifiable. It's not replicable. It's just, oh, I used this and this is what I saw in this patient. Okay, good to know. But when put up to an experiment, you don't see the same things. That's how medicine works. That's how medicines get approved. I am a pharmacist. Part of my job is to be able to evaluate medical literature and look at data to see whether something is actually worth giving your patients or not. Is there a clear benefit to giving them this medication or not? That is part of my job as a pharmacist. And without even knowing much else about this lady, the other details that she's a pediatrician, she's not really seeing acute patients, severe patients, things like that, or even just everything else that I've seen as far as the research that have come out saying this medication is not effective. Without knowing anything else and just hearing that video, that speech of hers, I could just tell you that that was inaccurate and it was propaganda, at nothing more than just propaganda. What I'm most surprised about actually is just how viral this got and how much attention this got. You shouldn't just believe everything that you hear. You should consider the source, consider the motive, and consider the data. And not just 300 cases out of the 4 million cases worldwide. That's less than 0.00001% of the number of cases worldwide. And the best researchers, the best doctors, everybody is on board trying to find a solution, trying to find a vaccine, trying to find something that works. Nothing has come out, but someone comes out of nowhere claiming they've got the cure, they've got the solution, 100% cure rate. Oh, sure, and let's just believe them. we really should do better, and we should be a lot more critical in our thinking. It's called critical thinking. Evaluate where this information is coming from, the motive behind it, and the data. What are they saying? Don't believe just everything you hear. You know, I saw someone, I saw someone say, this is why we can't go nowhere anymore, and why other countries have banned us from coming. And it's kind of true. It's very sad, but this is really why we can't go nowhere no more. Because we act like this. We fall for anything. And you see the result. So I just wanted to address that quickly because I got a lot of questions about this, unfortunately. So that is my Ask a Pharmacy Leader, Ask a Healthcare Leader question of the day. Thank you.